Thanks for watching the Voice of the People podcast here on kxnet.com. I'm Nicholas Kwolek. And today we're talking about what's going around the community and how you can keep yourself as healthy as possible. Joining me to talk about just that is infectious disease Dr. Supha Arthurs with Sanford Health. Dr. Arthurs, thanks for joining me.
Thank you for having me.
Oh, it's my pleasure. So before we get into the weeds, as they say, for people who may not have met you or know much about you, why don't you tell us a little bit about yourself?
So I am the infectious disease specialist at Sanford Bismarck, and I've been in the community for the last 16 years.
Wow. Oh, good for you. So I'm always curious, just meeting brand new doctors, what got you interested in studying infectious disease or becoming a specialist?
Well, it usually starts when you are in med school and we see like the infectious disease specialists and rotate with them and feel like this is the field that you want to go into, because I mean, for me, it's something that make a big difference on people's life, especially like the typically infection has good prognosis, it's very treatable. And say like HIV infection is treatable, people live, they can have normal life expectancy, pretty much. Hepatitis C is very curable. And I mean, all kinds of infection, it's just fascinating to me.
So take me back now, because you've piqued my curiosity. Was there sort of an aha kind of moment, like this is what I want to do, this is what I want to study, or was it a combination of sort of things?
I think it's a combination of things. I'm originally from Thailand. So when I was working, I used to work in the a border between Thailand and Myanmar, and we see a lot of patients from the refugee camp, and we see a lot of malaria, especially cerebral malaria. So people basically on their deathbed, and you can bring them back and they walk out of the hospital, and that's a really great feeling. So that's kind of like sparked my interest to infectious disease field.
Wow, I would say so. So tell me then, what did you take from your practice over there to North Dakota? In other words, what did you learn? What sort of experiences that you went through helped you to become the best doctor that you can here in Bismarck?
I would say that as long as you have empathy on how the patient went through their life, and that might lead them to their illness, and just understanding of what they've gone through and trying to work with them, because like not everyone can do exactly what you say. You just have to try to find a way that what works for them. We will help you.
I don't need to tell you, the last couple of years have been very tough on the medical profession. How have you kept going?
Yeah, so a lot of doctors and nurses, and I mean all healthcare worker in general, we went through a lot of period of high stress, and I mean just a lot. I mean, as you know, pandemic has a lot of weight down on us, so we just have to take a break. We might have to go through like I mean, burnout is very common. We have to deal with them, take a break, take a deep breath, like let go of things, and then get back to work.
Well, certainly we couldn't have done it without healthcare professionals like you. So thank you very much for all that you've done for us here. So speaking of which, as you said, you've been at Sanford now for 16 years.
Actually, I've been to Sanford Health probably about 6 years.
Oh, 6 years. Oh, excuse me. Okay.
I was over at CHI.
Oh, CHI. Okay, very good. So altogether though, combined 16 years. Okay. So tell me about what you're doing now as infectious disease specialist. What are you seeing right now as far as infections in our community and sort of sicknesses?
So, I mean, I see patient both inpatient and outpatient. So, I mean, in this season, we getting into like fall and winter, we see more cold, flu. COVID-19 is probably have like moderate activity throughout, like since the summer, and we're still seeing them. We start seeing influenza. RSV also is the start of the season. We have seen some whooping cough or pertussis in the community.
Mhm.
Probably a few cases, more so in Cass County or Fargo, but we certainly seen some in Bismarck area.
Mhm. And in your expertise, as just as a layperson when it comes to the medical profession, it seems as though sometimes certain things pop up one place, sometimes they don't. So how would you explain it to our viewers, when some things like whooping cough or RSV is another one that pops up maybe in more areas than one?
Yeah. So certainly whooping cough is preventable with vaccine. And the cases that we have seen, especially in the Bismarck area, has been an unvaccinated child or children. And I believe it's majority of the case are also unvaccinated in Cass County as well. So vaccination is definitely something that we all can do to prevent those.
Mhm. And also, I've seen it would appear as though there has been a little bit of an uptick or just some cases as far as walking pneumonia.
Um, I mean, like when you say walking pneumonia, you're talking about what particular organism? Like, I mean, certainly we regularly see walking pneumonia.
Uh-huh.
Um, I don't know if I feel that we see an uptick from the community per se.
Hmm.
Like you're talking about, this is probably going too deep, but like the organism that causes walking pneumonia, like
Yeah,
mycoplasma,
yes, yes, yes.
legionella. So those three things, or like the yeah, I mean, I'm not sure what you're talking, what you meant by walking pneumonia. Like you see the report, like what particular organism that's spiking.
Correct, yes, uh-huh.
Mhm.
Because in other words, the symptoms, I guess what I'm trying to ask is, and not very well, the symptoms, could you distinguish? Because I think, obviously people that have a cough, they have fluid in their lungs. I myself recently had some sickness, didn't have COVID, didn't have the flu, didn't have
Oh,
pneumonia. So
yeah,
then you go, well, what is it? Is it just some bug? How do you, that's what I guess I'm trying to ask, and not very well.
yeah. So like walking pneumonia, from like a medical term is typically those three type of organism, and we normally not always able to identify if like
Ah,
that you actually have those. It's something that's really hard to grow. There's no like a good test for that. So you just go
ah,
by that you have pneumonia and you still not in the hospital. You still not super sick. And that type of thing. And it can be treated as an outpatient. A lot of time it can be like viral pneumonia. People may not be like very sick in the hospital. Certain bacterial pneumonia, I mean, is something that happened to a young person like you who's immunocompetent. I mean, a lot of time it can be treated as an outpatient, and I mean, that from a layperson standpoint, I mean, maybe you can call that walking pneumonia, but like I
okay,
said, if you ask me, walking pneumonia is those three
okay,
typical organisms.
okay. Well, thank you for calling me a
Yeah.
young person. I appreciate I appreciate it very much. Um, so with that said, though, um, how does one if they have those infections? For example, when I had that sickness, I was, I kid you not, I had a bookshelf delivered. I was sitting in my
Mm-hmm.
apartment and just moving my books from my living room back into where I keep where they are now. I was sweating. I was literally drenched in sweat. So, what's the best precaution? If you're able to stay home, what's the best other than staying home? What are some of the best precautions if you feel like you might have something along those lines?
Yeah. So if you feel like you have those something along those lines, I would say that, I mean, stay home if you can. Good hydration, make sure you get enough rest, nutrition, and know when to seek medical attention. Like if you have high fever, if you start having like shortness of breath,
Mhm.
chest pain, dizziness, um, or just generalized weakness that you feel that your intuition know that you should go and seek medical help.
Mhm. Yeah, that's exactly what I did. So would there be a reason why we are seeing, uh, not saying there may be a huge increase, but other than the seasons, change in seasons, because another thing that a lot of people may not consider is, though maybe not as extreme, but seasonal allergies.
Correct, yeah. So sometimes that can be confusing. Do you have allergies or do you have a cold? Mhm.
Mhm.
Right.
So of course, obviously, if it's an
It's hard to
allergy, are those?
differentiate, yeah. And sometimes like allergies can lead to a viral infection.
Oh, really? Huh.
Yep, like if you have a lot of mucus producing, I mean, you kind of like make yourself um easier to catch those infections just because I mean, the symptoms that's kind of intervene, and just the fact that when you sneezing, you touch your um, face more often. You might not wash your hand and touch your face and like pick your nose and rub your eyes. So that's kind of like
Yes.
something to think about.
Sure. Yeah. I stopped picking my nose long ago when I was much
Mhm.
younger person than I am now. So good for me. I know. So anything else that you're seeing from or in and around the community that you would caution people or let them know what's going on and what they can do to get themselves healthy?
Well, as because we entering the season of flu and cold, I would encourage anyone to get their vaccination for yearly influenza vaccine.
Mhm.
If you haven't got updated COVID-19 vaccine, you can consider that. And for older adults, if you are 60 years and older with high risk underlying illness, or anyone 75 years and older, you can and should receive RSV vaccine.
Mhm. Okay. Um, Now you've been doing this for a while now, as you said. So I know one of the common objections to getting some of those shots would be, I don't want to get the shot because I don't want to possibly feel sick when I get. Can you tell me a little bit about what your response is to that when people give you that objection?
Well, so the side effect of the vaccine is much better than having the infection itself.
Mhm.
Um, and that's like really true for especially for older people with comorbidities.
Mhm.
Um, the vaccine that has been available and offered to people at this time is very safe, very, very safe. And I just encourage them to get vaccinated, not just to protect themselves, but also people around them.
Mhm.
If you are, you have your loved one with immunocompromised, taking chemotherapy, or have like kidney disease, heart disease, COPD. I mean, you not being sick,
Mhm.
um, help them not getting sick as well.
Sure. And besides those precautions, what are some other things people can do to help encourage others to stay safe and not that they shouldn't come and see you, but in other words, so that you
Right.
guys can see a reduction in possibly severe infections.
Right, yeah. So good hand washing, good hand hygiene. Cover your nose and mouth when you cough. Stay home when you're sick. So those are simple precautions that we just want to remind people that we all should do.
Sure. Okay. Well, is there anything else that we should know about helping maybe make your job a bit easier as we get into the next season?
I think that's all. That's all I have.
Okay, well, I think it's kind of funny that we're talking about all of this today, not the subject matter, but because we saw our first snowfall. We're
Yeah,
taping this on Friday, November 1st. Uh, so if you, I guess, so basically what you're saying is if you haven't got your vaccines, help with those seasonal uh, infections, possibly go get them, right?
correct. Yep.
Okay. Okay. Well, Dr. Supha Arthurs, I can't thank you enough. And I'm hoping that for everyone's health and their own sake, they heed your advice and the advice of other health professionals. So thanks again for all you do for us here in the community. And thank you for watching the Voice of the People podcast here on kxnet.com. We'll be back soon with more on the questions and answers affecting you. Because remember, it's your voice that matters, the voice of the people.